Flashing the lights.
So we got the one and only Ricky Fishman here in our group.
All right.
Woohoo! As we all know, he's a very passionate chiropractor, passionate about the work that he does, and he's got an office, a great office right on Union Street, Union and Goff, I believe. And he's been in business for 23 years, 24 years, has a ton of experience, including being a college professor, a bicycle messenger, a musician, an educational tour leader, in addition to his work as a chiropractor. He has one son. Is he still 19?
He'll be 20 this month.
He'll be 20.
One more year to go, God willing.
He lives in Berkeley. And his key to success is that what this is? Is that your key to success? On a summer trip
No,
to...
that's something no one knows.
Oh, let's do that one. Something no one knows about Ricky. On a summer trip to Europe when he was 18 years old, he ended up taking a detour to Afghanistan that ended up perhaps hashish inspired? Oh. I was just,
Really?
Much information.
Back problems.
Statute of limitations.
I didn't read this before I read it. To dedicated his work life to travel, education, and healing. Here's Ricky.
I'm going down.
Okay, so I want to read a little something that I found in a book by Thich Nhat Hanh. Thich Nhat Hanh is a very famous Buddhist monk from Vietnam. He's written many, many books. He's a very deep and profound philosopher, poet, writer. So very, if anyone has a chance to read this stuff, I recommend that they do. But he wrote something that resonated with me, and I wanted it to be sort of the starting point for my presentation today. So he writes, this is from his book on anger. There are toxins in our body, and if our blood does not circulate, these toxins will accumulate in certain places. To remain healthy, our organism must expel these toxins. Massage helps stimulate circulation, then this nourishes organs like the kidneys, liver, lungs, and to help expel the toxins from the body. Drinking water, deep breathing help eliminate through the skin, lung, all of these different types of toxins. And the blocks that result as because of this lack of circulation also cause pain and oftentimes despair, and they want to come out. These blocks want to be removed to allow the circulation because they become larger and larger as we don't deal with them. They don't want to emerge. They want to emerge, but we don't let them because they're painful, and we suppress them. We suppress them with drugs, alcohol, busyness, television, on and on. Avoiding the pain through suppression, we prevent the circulation of movement, and then that results in physical manifestations that cause us pain. And in a lot of ways, what I do is I work on locating the areas or blockages where things have just become stuck because the movement has stopped. And movement really is one of the keys to health. And it goes beyond just physical movement. It goes to the movement of relationships. When relationships stop moving, they break down, they deteriorate, and they wear away and die. And when someone presents in my office with pain, which 95% of the time people come to see me, it is because they're in pain. The thing I want to locate is where things are not moving. And the place I start with is the body. And so when I'm doing an examination, I'm feeling the muscles in that person's body, and I'm feeling for places where there are knots. That tells me there's no motion there. When I'm feeling the person's spine, and I find an area where there's no movement, that's the area of hypomobility that needs to be manipulated. Because when things are not moving, blood cannot flow through those areas. Energy cannot flow through those areas. Lymphatic vessels cannot push the fluids that need to be pushed through the body. They cannot move through those areas. And so you get an accumulation of these toxins because of the lack of motion in these particular areas, and those become the focal points of pain, because when you have these areas of congestion, you have all these nerve endings which are running through that area, and they're being stimulated because of these blockages. And that's what the person is presenting to me. So what I want to do is, when I locate these areas of tension, I'm going to work on relieving them. So I'm going to massage the muscle with, I have a variety of techniques to push all this gunk, this toxic gunk that has locked up in that place. I'm going to push that through. I'm going to locate the vertebrae which are not moving, and I'm going to adjust them to allow movement through those joint spaces. But even more important, I'm going to look at, well, what are you doing in your life which is causing this blockage? What is it that's, because if I find an area that's blocked and I move it, but the cause of that blockage is not being addressed, all I'm doing is putting a Band-Aid on a problem that's going to return. So I want to get as deeply as I can and as close as I can to the actual cause of the problem. So first thing I want to do is look at their posture. How are they holding themselves? Okay, because if you're slumped forward, that creates a tremendous amount of mechanical stress that's going to cause focal areas of locking that will contribute to this problem. So we want to work on getting the posture corrected. What are they doing that's contributing to that postural distortion? How are they sitting at their job? Are they taking breaks? Are they breathing? Are they exercising? Are they, what are the many things that are contributing to this postural distortion, which then leads to this muscular tension, which then leads to the accumulation of these toxins, which causes pain. The closer I can get to the original source of this person's problem, which ultimately results in pain, the greater service I'll be doing for them. And finally, the most important thing that I'm going to work with that person on is teaching them why this is going on, why this is happening. Because the idea is not to have a patient come to see me 3 times a week for 4 weeks, and 2 times a week for 4 weeks, and 1 time a week for 4 weeks, and actually create a dependency on my treatment. What I want to do is teach them why this is happening, so that they can then be empowered to take control of the situation and also adjust to new situations that they may encounter, so that they then are able to manage their own health. I'm much more interested in an active empowerment model than a passive dependency model. And so, for me, being a chiropractor is fundamentally about being a teacher. I mean, I'm a technician. I'm going to help the person get out of their pain syndrome. But if I can teach them how to take care of themselves, then I feel like I've done my job in the deepest possible manner. So, if there are any questions, I'd be happy to answer them.
So is there a mind thing that happens as well? I mean, you probe what's going on in their minds that actually is causing the body to do what it does, that causes the knots and buildups?
Well, one of the things that I talk to my patients about is the various types of stress, because ultimately it's about stress and how you manage stress. Whether it's physical stress of sitting in front of a computer, or emotional stress, I hate my job, I hate my life, and so you're in this sort of state, which then compounds the mechanical stress. Then there's chemical stress, what are you putting into your body, or what kind of environment are you working on? And then there's even a deeper level of stress, spiritual stress, I would call it, where are you on purpose? Are you living the life that you want to be living? Because if we're not doing that, if the way we are living is not consistent with who we are in a deep manner, that generates an internal friction that also manifests in a somatic stress, which contributes to this syndrome. So what I'm doing is I'm going to try to identify as many areas as I can, and if it's something that is beyond my realm, because I'm dealing mainly in mechanical. I don't believe in treating everything. Because I think for a practitioner, as important as it is to know what you can do, is to know what you cannot do, and have a full network of practitioners to refer to when you can identify something that is beyond your scope but is contributing to the person's problem, and then work together as a team with those practitioners and with the patient.
Great, thanks, Vicki. Great.